Hey. Oh, we need people to join. My chair is squeaking. Hi. I want to sit my phone down. Can you still hear me if I sit my phone down? Hopefully so. Hello, Devin. Brendan. Hi. Hello. Kevin. Hello. How's it going? Hope you're staying healthy, safe. We will get started shortly. So today we're just giving another update on COVID-19. Want to make sure that we keep you all aware and in the loop with all that's happening. So cases are rising. Things are changing. There have been several announcements from D.C. and Maryland. Haven't heard too much from Virginia yet. But want to share some new information with you all. Keep everyone's in a loop. Know that the holidays are coming up. Folks are planning to travel and be with their families. We want to make sure that you're completely informed about COVID-19 while you make those decisions. Obviously, I'm going to tell you to plan to meet your family remotely. That's the safest way to celebrate this holiday season. The pandemic is getting worse. We are seeing an increase. And so in the U.S. alone, there have been more than 12.4 million cases reported as of today. Also, as of today, there has been 258,172 deaths. So that has increased a lot since my update last week. We're also seeing more cases rise in the D.C., Maryland, Virginia area. So I'll talk a little bit about that. But new cases in the U.S., just from yesterday, 17,637 new cases. And that's been over 500 deaths today. So COVID-19 is still killing around 1,100 Americans a day. I actually saw on CNN that number could be around 1,300 a day. So we are definitely seeing an increase in cases. So we want to make sure that we keep those practices that we have in place. As for DC, the data we have for as of November 23rd, which is yesterday, there have been 119 new positive coronavirus cases, which brings the total DC positive cases total to 20,409. The district had reported one death yesterday. It was a 93-year-old person that passed away reportedly from COVID-19. Unfortunately, about 673 district residents, which that number is still growing, have lost their lives to COVID-19. For Maryland, as of yesterday, there's 185,464 confirmed cases. That number has increased about 1,600 just in 24 hours. It's really rising. There have been over 4,000 confirmed deaths, 32 of those just in the last 24 hours in Maryland. We have over 1,300 people hospitalized in Maryland, and about 65 of those folks were just in the last 24 hours. For Virginia, it's getting, yeah. I hate saying these numbers, but I want people to know, it is extremely important that we take this serious, because the numbers are on rise, and I mean the data speaks for itself. Again, for Virginia, 223,582 cases of COVID-19. In the last 24 hours, 2,544 were reported in the last 24 hours. There's over 14,000 hospitalizations for COVID-19 in Virginia, and so far the total death number is 3,979. So, with the rise in numbers, after we've gotten all that negative information out there, I want to give you some late breaking information. So the mayor actually announced yesterday some new restrictions. So we've had those previous travel restrictions where it was announced that you must get tested within 72 hours if you're traveling to the District of Columbia. So if you're planning to come here to visit family, the mayor is suggesting that you get a test within 72 hours of traveling. If that test comes back positive, you should not travel to DC or to anywhere. Also, visitors, if you have come in close contact with someone that was diagnosed with COVID-19, you shouldn't travel as well. Also, there are some new restrictions that were announced. And it is changing some things that will impact businesses in the District of Columbia. So there are new restrictions that go into effect Wednesday, November 25th, which is tomorrow. Those include the limiting of indoor gatherings to 10 people. So that is a big change because that's down from 50. The mayor had announced when we went to phase 2 back in June that it would be 50 people. We're scaling that back down to 10 people. So Mayor Bowser has said that this is phase 2 modified. Again, 10 people or less for indoor activities. Outdoor activities, except for worship services, are down to 25 people. So even if you're outdoors, you cannot be more than 25 people. That also includes events with your family members. That's down from our original phase 2 announcement of 50. So as of today, or as of tomorrow, I should say, 25 folks for outdoor activities. There will be a suspending of group indoor exercise classes, and there are limited access to classes up to 25 people for outdoor workout sessions. Individual workouts, you can still go outside. You can still do that if you're going for your runs. Just make sure you wear a mask. And more guidance is actually coming out soon about, these organized sports events and things like that. Alcohol sales are also being restricted. So alcohol sales at restaurants must stop at 10 p.m. However, dining can stay open until midnight. Worship services, again, that's at 50 people or 25% capacity. So whichever is lower. So if you are going to church or any other worship services, it cannot be over 50 people or 25% capacity, whichever is lower. Also, if you are a non-essential business, we're encourage you to telework. That is extremely important. And also, we are suspending live entertainment. There was a pilot that was announced, but that pilot is being suspended. So the 6 venues that were in that pilot will be engaging in that pilot until further notice. In Maryland and Virginia, indoor social gatherings are not allowed larger than 25 people. So if you're having an indoor gathering in Maryland and Virginia, it has to be less than 25 folks. Again, we do not encourage you to have any in-person gatherings for Thanksgiving, but we want to state the facts here and the advice that was given from the states themselves. Maryland is strongly advising folks who are traveling to states that have a higher than 10% positivity rate that they don't travel. So that's Maryland guidance. Also in Maryland, bars, restaurants, and venues that are serving food must close between 10 p.m. and 6 a.m. Retail establishments and religious facilities have to be reduced to 50% in line with all of the other dining establishments and those type of personal service establishments. Also, indoor visitation in Maryland at nursing homes will be limited. So the state is encouraging that visitors to nursing facilities get tested for COVID-19 within 72 hours of their visit, and you have to show a negative test in order to visit. Now, for Virginia, there are not any quarantine announcements at this time. However, Virginia is definitely encouraging the guidelines from the CDC. So if you're unfamiliar, you can go to the cdc.gov to look at what those guidelines are. But you should definitely be wearing a mask. Keep that 6 feet of physical distance between you and any other person, especially if you're indoors. And if you're engaging with folks outside of the people that you live with, or people in your pod, meaning the people that you've made an agreement with to just only see those people, you should definitely be wearing a mask. So with those new restrictions in the DMV area, what does that mean for holiday travel? Like I said before, Whitman-Walker, myself, we are telling you that you should consider meeting or visiting family virtually. Unless they live in your own household. It's totally fine if you have members in your household that are not visiting others to meet and celebrate Thanksgiving or Christmas or anything else that's coming up during the holiday season. If you are, organizing larger events, please consider the regulations as I mentioned. Most states and DC itself are saying crowds should be kept less than 10 folks. So keep that in mind if you are having an in-person event. Again, we're not encouraging that, but you can lower your risk by having smaller groups. If you fall into one of these categories of people, you should not attend in-person gatherings at all. So if you have been exposed to COVID-19, do not attend an in-person gathering because obviously you'll put others at risk. If you or anyone in your household has been diagnosed with COVID-19, you should not be going to a in-person event to help prevent the spread. If you have any symptoms of COVID-19, it's probably best that you get tested and try to avoid in-person events. If you have been exposed and you are awaiting your viral results, still, you should wait for that negative test result before you consider seeing anyone in person. Also, if you have been exposed to anyone with COVID-19 within the last 14 days, you should avoid in-person contact with others. Also, if you're a person that has an increased risk of illness, in-person gatherings probably would not be the best thing for you because it puts you at higher risk. Also, if you are an older adult or a person with certain medical conditions, that will put you at a higher risk for COVID-19, so you should avoid that. So with all that said, everyone is still required to wear a mask. There hasn't been any changes or any change in guidance as far as wearing your mask. Wear your mask, keep that 6 feet distance of separation between you and other folks. Again, the benefit of wearing that mask is that, it basically prevents, if a person is carrying COVID-19 and they cough into their mask or spit or whatever, that it kind of keeps that enclosed so it doesn't impact the environment outside of that mask, right? And so if you are if we are all as a community wearing masks, it'll help reduce the spread of COVID-19. So again, wear your mask, keep 6 feet distance. So it is cold. Indoors is not necessarily the best place during this pandemic of COVID-19. So if you are planning to have a small gathering, plan that outdoors. That is the best approach. Outdoors will always be better than indoors during this time. If you are going to be indoors, consider open windows, create some type of airflow. Again, wear your mask, keep your distance. If you feel that you want to celebrate with someone, make sure you're in a close-knit pod, or again, someone that lives in your household, meaning like family member, friend, roommate that lives in your household. Continue to wash your hands, 20 seconds. You can say your ABCs, and that'll be more than enough time to let you know that you have washed your hands. So the way you should wash your hands, scrub between your fingers, fingertips, thumbs, back of your hands, down about as close to your elbow as you want to get, and rinse with warm water. Also, if you have others in your household that are at risk, you might want to make a plan for isolation or quarantine, just in case that you come down with COVID-19 or they do. You want to have a plan of how you're going to operate within that space. So make a plan for how you would quarantine for 14 days or how your the people in your home will quarantine for 14 days. Additionally, I want to give some vaccine updates. So I haven't heard anything new about the Moderna or Pfizer vaccines. So I'll just state the previous facts about the vaccine. So lastly, the Moderna, last week, the Moderna vaccine was announced to be 94.5% effective. Pfizer was at 90% efficacy. Again, both of those companies are planning to apply for FDA authorization to begin vaccinating the public. Again, the folks who will probably get that vaccine first will be the higher risk populations, which means those essential workers who are working in the health field, doctors, nurses, those people who might come in contact with COVID-19 through their daily work. They will probably be the first ones who get the vaccine. And then, higher risk folks from that. And so that hasn't actually been communicated from the government yet, but that is at least what has been suggested from these companies. All right. You can still get tested at Whitman-Walker for COVID-19. I've actually pinned an incorrect number at the bottom, but if you want to call us, it's 202-797-4438. Sorry for the 9 in there. You can set up an appointment if you are having symptoms, we can do an in-person appointment, same day or next day. Just give us a call. And that's all I have for today. I do want to add that, social distancing is definitely the way to reduce COVID-19 transmission. Obviously, increasing that physical distance between you and any other person definitely helps avoid spreading the virus. So when I say physical distance, that involves, again, staying 6 feet distant away from other people, wearing your mask, avoiding places and events of large crowds, work from home if you can, speak with your loved ones on FaceTime, Zoom. Again, I mentioned last week that I'm going to make plans to connect with family over Zoom, and we're going to cook together, and that's going to be our little Thanksgiving tradition for this year. Also, if you think you're going to be at risk, continue social distancing, try to avoid, face-to-face contact. Remember that people can be a carrier of the virus and not have any symptoms from 2 to 14 days. So you could be around someone who, has it, doesn't know it. So just make sure you wear your mask, keep your distance, and that'll help reduce the possibility of transmission. Also, we have a site, whitman-walker.org/distancing care. If you have trouble navigating social distancing, There's some guidance there for you. Again, that website is whitman-walker.org/distancing care. Also, if you have lost someone from coronavirus and you are in need of support services, Whitman-Walker does offer, therapy and support services. So you can reach out to us at 202-797-7000, and we can help set you up with that stuff. And for Roderick, I will be cooking collard greens with my family on Zoom. I'll be making a bunch of other stuff, but I'm getting particularly on Zoom just to get this collard green recipe down pat. That is the update I have for you all today. I do want to add that, it is stressful times. Holidays are always stressful. Traveling, trying to spend time with our family. The pandemic just adds another layer on it. We want to make sure that you all stay safe, you stay healthy, stay physically distant, be kind to one another, and we'll get through this together. Also, Whitman-Walker is here to help. If you need any of the resources I mentioned, you can give us a call, especially for COVID testing at 202-797-4439. Also, if you're in DC or the DC area, you can visit coronavirus.dc.gov, and that will give you testing locations. They actually update it daily. I've gone a few times to get tested for COVID-19. The lines are getting longer and resources are getting tighter. I actually went to a testing facility yesterday, and they ran out of their 700 tests within, I think it was like 2 or 3 hours. So get there early. Lines are getting longer. Resources are tighter, but try to get some tests. If you are going to, see family, again, not encouraging, at least try to do your due diligence, get a test within 72 hours of coming in contact with them. And let's do our best to help reduce the spread of this virus. Again, I'm Sir_Dave_ on Instagram. You can follow me there. You can also continue to follow Whitman-Walker on Instagram, Facebook, and Twitter. And I want to say thank you all. Again, stay safe, stay healthy.